Support for Conversations Live comes from the members of WPSU and from the Gertrude J. Sant Endowment, the Sidney and Helen S. Friedman Endowment, and the James H. Olay Family Endowment.
Do you have a pet or two, or are you thinking about getting one? Do you have questions about the best diet for your cat, how much exercise your dog needs, or why your four-legged friend is misbehaving? Animals play an important role in many families, bringing companionship, fun, and affection. Tonight, join us on Ask a Veterinarian. We'll help you find the answers you're looking for. Hello, and welcome to Conversations Live. I'm Ann Danahy. Having a pet or animal can bring you joy, but caring for them can also be a challenge at times. Tonight, two expert veterinarians are here to answer your questions and share tips on having a happy, healthy pet or animal. Let's meet our guests. Dr. Andrea Lohr is the medical director at CP Vets, an emergency and critical care facility in State College, Pennsylvania. A graduate of Cornell University College of Veterinary Medicine, Dr. Lohr also raises beef cattle with her husband in Clearfield County. Dr. Fred Metzger is medical director of the Metzger Animal Hospital, a general referral and 24-hour emergency hospital in State College. A 1986 graduate of the Purdue College of Veterinary Medicine, Dr. Metzger received the Distinguished Alumni Award from Penn State, where he serves as an adjunct professor. And whether you're watching us on TV, streaming us online, or listening on the radio, we want to hear from you. Call us with your questions at 1-800-543-8242 or email connect@wpsu.org. Dr. Andrea Lohr and Dr. Fred Metzger, thank you so much for coming in to talk with us.
Thank you very much for having us.
It's like another day at the office, Ann. We want to hear your questions.
That's right. You'll get a lot of questions, just like you do on most days. Well, the first question I have for you is about the holiday seasons. We're approaching the holiday seasons, and I know a lot of pet owners, myself included, you want to give your pet a special treat, or you want to give a family friend's pet a special treat, and that might be saving a little turkey for the dog or a special cat treat. Dr. Lohr, what advice do you have for people who want to do something special for a pet, but you still want to be healthy?
Sure. So we have to be careful when we do special things for pets because we can end up causing things like gastrointestinal distress or vomiting, diarrhea, that type of thing. So I often think about using white meat chicken or turkey as a special treat. Also, cats love boxes. So even just those simple, easy toys that the pets might like. But being careful, and the best thing is always to ask the owner if it's not your own pet what their pet might like.
So it actually might not be a bad idea if you're baking a turkey or a chicken, you could set a little bit of that aside for the pet, just something simple.
Yes.
Okay. And Dr. Metzger, what advice do you have?
Same as in us, moderation. I own pets. I want to give treats to my pets as well. But you really want to watch the fat content especially, because especially in animals, you can have dietary allergies. Some of them can have digestive problems, and you change a diet, and we can get problems like pancreatitis, which Andrea and I are going to see in the ER service, which can be really dangerous. So moderation, small amounts, anytime vegetables. I mean, many of our dogs will eat carrots, celery. Some of them are like, forget it, I want the turkey. Okay. That's fine, but just small amounts. Low fat is always a good idea.
Okay, so maybe not the mashed potatoes and stuffing, but a little of the chicken or turkey.
Yeah.
Yes.
And what about cats? Can they have vegetables? Some cats actually like them, right?
My cats like zucchini.
Oh
So yes, cats can have vegetables.
Okay, so that's healthy for them too. And another issue that comes up over the holidays is animals getting into problem things, whether it's the food or the holiday decorations. What are some common problems that you see, and how can people avoid them?
Well, something that's happened in my own family is the chocolate. We often want to give chocolate to our friends and coworkers as gifts, but knowing that if the pets get into that, it can cause significant problems. Gastrointestinal upset, but it can also in dogs cause heart problems, cause their heart rate to go too high, and really be a big problem.
So some big issues.
Yes.
Well, for me, I'm always worried about foreign bodies or animals eating things, cats, tinsel, bones. If a dog would get into the garbage, or someone wants to give a turkey leg, which is really a no-no. any kind of bones can cause real problems. They can cause gastrointestinal obstruction, and we just see just horrible problems with animals ingesting things they shouldn't. Socks, but you know, this time of year, bones would be a real problem. Tinsel in cats, decorative ornaments, strings, anything that's
Curling
a string.
ribbon.
Huge problem for us. So we really want to watch that in our pets.
Okay, so if you are sharing some chicken and turkey, you just want to give the meat and not make sure they aren't getting any of the bones,
Yes.
too.
No bones, please.
Okay. If you're just joining us, we'd be happy to take your question. We're talking with two expert veterinarians on Conversations Live, Ask a Veterinarian on WPSU TV, FM radio, and online at wpsu.org/live. Joining us tonight are Dr. Andrea Lohr and Dr. Fred Metzger. Our toll-free number is 1-800-543-8242, and they're ready to take your calls. You can also send us questions by email at connect@wpsu.org. And we do have our first question here. It's from Becca in State College, and Becca writes, "My cat Pepper is 15 years old, and recently I have noticed that her claws are growing thicker. It appears that she's not fully shedding them. I encourage her to use a cat scratcher and try to keep them trimmed, but they are getting harder to trim and more sensitive to touch. Why is this happening, and what can I do to help? Is this a common problem?"
One thing I would say, several things right away. A 15-year-old kitty, so you know we're talking an older kitty, when someone tells me the claws are changing, it can certainly be nutritional, but one other thing I always think about is hyperthyroidism or elevated thyroid levels. Very common disease in the older cats, can cause thickening of the nails, other problems. Usually the cats are hyperactive, they're losing weight, some of them are vomiting. That would be one thing on the differential diagnosis, meaning possibilities. There's certainly others as well, but that would be one I would definitely think of in a 15-year-old cat.
Okay, and we actually have a picture of the cat in the claw, so does that seem like it might be a problem?
Yeah, it looks like a pretty
It's a pretty thick
claw.
nail. The other thing that I would be thinking of is does your kitty have some arthritis that may be changing how she's walking or scratching on the scratching post, maybe not wanting to scratch as much. So certainly a good evaluation by your veterinarian is in order to evaluate for that, potentially some blood work, as Dr. Metzger had suggested, for looking at the thyroid level and other organ function tests to make sure that there's not some other problem, but arthritis would be another differential diagnosis for me.
Okay, so we hope that helps out, and we are getting some calls. And our first call here is from Bonnie in East Freedom. Hi, Bonnie. Thank you for calling. What can we help you with?
Well, I wanted to talk about cats and dogs and their dental. I know it's important to get their teeth cleaned when they have a buildup of tartar, but what do you think of the product that you put in their water that's to control the tartar? I know it would have to be after the teeth were clean, but is it worth it to put that in?
Great question.
I've had very poor luck with any of the dental products. I mean, the reality is, we're going to cop out and say every time you should ask your veterinarian.
Sure.
I mean, because we're sitting here,
Absolutely,
we don't know
yes.
the situation.
Yes.
But as a general rule, here's what I'm going to say about dental disease. It's very common and very rampant in our pets. It's a major problem. Most of our pets are not brushing their teeth. The owners have trouble brushing their teeth. I don't brush my own dog's teeth, and I'm a vet. Okay, so regular dental care is very important. You need to talk to your veterinarian. The other thing we should talk about just briefly is why people say this all the time. Why do you need anesthesia? Like, I go to my doctor. Well, you have to have anesthesia to do a proper, first of all, dental exam and dental prophylaxis. To clean the teeth and clean under the gum line requires anesthesia. So we're sorry that we have to anesthetize your pet, but to not do it, you're not doing anything. Some people will scrape the tartar off, but it's not doing anything. So the dental products like you're talking about, I'm not going to have a big problem as long as the teeth are cleaned, and then if you want to try that, that would be okay. But usually people want to try those products when there's already a lot of tartar. It's just not going to do much.
Okay, so preventative care.
Right, yeah.
I understand.
I think, Bonnie, you said that you understood that they needed to be cleaned first, which is great.
Right.
I think
Right.
that any of those products, with your veterinarian's recommendation, could potentially delay the time between cleanings, but they're not a replacement for regular dental checkups and cleanings.
And now if you're willing to brush the teeth with pet-approved toothpaste, that actually is a really good idea and will help, and you should ask your veterinarian.
We hope that helps, Bonnie.
Okay, it has. Thank you very
Thanks,
much.
Bonnie. Thanks
Thank
for
you.
calling.
Thanks for calling.
Bye-bye.
And we have another call coming in from Judy from Warren. Hi, Judy. Thank you for calling. And what can we help you with?
Hi, I have an asthmatic cat, and he's on protein 1 only, dry cat food, and I wanted to know if he could have any kind of treat.
So is your cat allowed to have treats?
So your cat has asthma. Is your cat on medication for the asthma? And does he have a diagnosed allergy that is related to
Yes.
the diet? Okay.
Yes, he does. He has a food allergy, so.
Okay. All right. So.
But he's on no medication.
Okay. So the best thing, because if your pet has been diagnosed with a food allergy by your veterinarian, they would
Yes.
have the results to know what foods your pet is actually allergic to, and could help direct you towards appropriate treats for her. I wouldn't want to tell you that something was okay without all of the information when we have a diagnosed allergy.
And one thing I would just say, food allergies, people throw the term food allergies around a lot. There just are no good tests for food allergies in pets. You could run a blood test, but they're not very accurate. And really the only way of diagnosing it is an elimination diet, which can be very difficult because that can take several weeks. So one thing that I like, Judy, is with asthma, which is a pretty serious disease in the cat, like it is in the human, if you're getting away with doing dietary therapy to help it, that's fantastic, because normally we need medication.
Yes.
Most asthmatic cats are either on a steroid or an inhaled medication like an albuterol or a corticosteroid. So if you're able to do it with diet, that's fantastic.
I hope that helps, Judy.
Yes, it does. Thank you.
Thank you. And it looks like we have another call from Luke in Coudersport. Hi, Luke. Thanks for calling. And what can we help you with?
Hi. A couple of moments back, listening, my jaw really dropped. My best friend, shares the queen bed and all that. My 3-year-old lab, Freya. I regularly feed her beef bones cut to like 1.5 inches, maybe 2 femurs that are frozen. And she absolutely adores them. Now, one quick thing, a long bone, she might shatter that and wind up eating a fair amount of bone. But with these pieces like I described, it's like, oh my God, don't tell me I can't give those to her. So that's what I'm thinking.
All right. Well, thanks, Luke. Is this a good idea to have a bone like that?
It really is not. It sounds like you've gotten lucky with Freya to this point, which is great. And it's certainly, as her owner, it is at your discretion, but we definitely would advise against it.
Luke, and I'm with you.
Like beef and all that.
Luke, I'm with you. You got to live.
I understand.
You got to have fun.
Any bone.
Here's the reason I made that comment. One is a general rule. Is what I worry about. Yes, you can do the long bones in a lab. I'm a big lab fan too. As we know, labs will eat anything. But the problem is when you start getting the shards of the bone and the smaller pieces, not only do I worry about foreign bodies where they ingest them, but getting into the colon. That can really cause problems where you have shards of bone now that are in the colon and it can cause an impaction. So I've been a vet 33 years. I've seen some horrible things that are really sad, and bone foreign body is certainly one of them. So that's not going to happen in every dog. Just like chocolate toxicity is not going to happen in every dog. But, I'm always trying to prevent a problem. What I like is it sounds like you're really watching your dog too, and you know your dog really well. So you're probably cool.
And I've seen where she's, shattered a long bone and eaten a lot, and the poop is frightening looking.
Yes.
So you might be okay, but in general, it sounds like you're saying advising against that. So
yes.
We hope that helps. Thank you very much.
Thank you.
Thank you.
Bye-bye.
And we have another call, and this one is from Thomas in Brookville. Hi, Thomas. Thank you for calling. And what's your question?
Hi. Yeah. My cat Snow is a bit older. He's 18 or 19, and he was recently diagnosed with kidney disease, and he's losing some weight, and he's not eating well. And I was wondering, what can I do to stimulate his appetite or get him to eat better?
There are a lot of options for this. There are some medications out now that we're using to help with appetite. I'm sure you're probably already trying all of the special things. So, generally in cats with kidney disease, we like for them to be on a special diet. But if they're not eating well, then we try extra things like the white meat chicken or canned tuna, even going to the store and getting some lunch meat, some chicken or turkey lunch meat, and baby food even. So those are all good options. But if he's still not eating after that, then talking with your with your veterinarian about medication that might help with nausea or help with appetite stimulation would certainly be warranted.
I mean, when you say chronic kidney disease, this is a huge problem in older animals. And I always worry because this is a time when it sounds like your veterinarian has the diagnosis, but we see a lot of second opinions. And in an older cat like that, I'm always worried about comorbidities or other diseases. Hyperthyroidism, I mentioned earlier on with the other caller with the claws. That's certainly one that we can see with chronic kidney disease and other problems. So I think a good review of the diagnostics, which would be the blood work and a urinalysis, make sure that's current with your veterinarian, and then an appropriate diet. Because the big thing is there's different stages of kidney disease. We call it IRIS stage 1 to 4. I won't bore you with the details. But like a stage 4 cat would be an advanced cat where you really would not want to do a higher protein diet, whereas with 3 or 2 you might want to. So that's a very complicated and common disease in the older cat. But diet is really important. And we start losing weight, that's a signal that we might need to do something different.
And that's great, Thomas, that your cat is living to 18 or 19 years old.
Great.
So thanks for your call, and hope that helps.
Yeah, I hope so too. Thank you.
Thanks.
If you're just joining us, I'm Ann Danahy, and this is Conversations Live, Ask a Veterinarian on WPSU TV, FM radio, and online at wpsu.org/live. Joining us tonight are Dr. Andrea Lohr and Dr. Fred Metzger. Our toll-free number is 1-800-543-8242, and our panel is ready to take your calls. You can also send us questions by email at connect@wpsu.org. And I think we already have another question lined up for you. And this question is from Cindy from State College. Hi, Cindy. Thank you for calling. And what can we help you with? Hi, Cindy. We might have lost Cindy on the line. Are you still there, Cindy?
I'm still here. Can you hear me?
Hi, Cindy. Yes, we can hear you. What can we help you with?
So I have a poodle who's 1 year old, and she will only eat her kibble if we put chicken with it. And I'm wondering, am I sort of knocking the balance of protein out? I'm worried that she's just getting way more protein than she should, and B, it's actually a lot of work, particularly when we travel with her.
Yes.
So advice on feeding the dog, the new dog.
So I think that a lot of times our pets can trick us into doing things that they don't necessarily need. So, one of the questions would be, is this something that you started because she was a little reluctant to eat one night, and then she picked up on the fact that if I don't eat right away, I'm going to get some chicken added to it. Unlike in cats, with dogs, we can wait them out to some extent and try to encourage them to eat their food. Because it is just like our kids. If they don't eat their broccoli and you start adding cheese sauce and other things, then it makes it such that they're more likely to eat it, but they've won. The other thing would be, if this is a new problem, checking in with your veterinarian. I hate to sound like a broken record, but a workup is never the wrong thing to do. Is there some sort of problem that's causing her to be more reluctant to eat, that's requiring the chicken to tempt that appetite to a point where it could? So an examination by your veterinarian, maybe blood work, and a good oral exam is probably worthwhile if this is a newer problem.
Dr. Metzger,
they totally work us. I have dogs, all right? They work me. My dogs own me. I totally am with you. And they give you the sad eyes. I mean, here's the official veterinary answer. You really don't want to do that, because the better brands of dog food, the brands that we're familiar with, are balanced. Those are balanced rations for dogs. Make sure you're looking at an age-appropriate and even size-appropriate diet now, because there's small breed growth diets, small breed adult diets, wonderful diets. That's all they need. Do I ever give my dog anything else? Of course, I'm a person, you know, and I have 2 dogs that are really good beggars. And just like our kids, I have 2 daughters, same thing. So I would get tough if you can, and maybe use chicken just as a treat now and then. But I would really recommend to try to stick to the dog food because, once again, if it's, you know, made by Purina or Science Diet or Iams or one of the brands that we recognize, stick with that. It's balanced for dogs, and they'll live a lot longer. And by all means, watch the weight. We know in people, and this is proven in animals even more, you keep the weight off, you can add years to their life. That's a known fact. So stick to a good diet, make it tough, maybe use chicken as a treat. But I wouldn't want to be mixing it in because they'll totally work you over then to the next thing.
Yes.
We hope that helps, Cindy.
Thank you.
Thank you.
Be tough, Cindy, you can do it. Even though I don't do it on mine, you can do it.
We can give each other support to be
Yes.
to be,
Support group.
Right,
Yes.
tougher with our pets. And we have another call. This one is from Alicia in Reynoldsville. Hi, Alicia. Thank you for calling. And what can we help you with?
Well, hello. I have a cat. He's not that old, but he has a kind of a disease where they have to give him kind of like a shot so he doesn't drool too much. But I'm handicapped. He's a very good cat. I've had plenty of time. He's smart. He can fetch and roll over and all kinds of things.
Wow.
However, now that he's getting a little older and he doesn't like getting those shots from the vet, he's gotten very sensitive. He acts like a Dr. Jekyll and Mr. Hyde.
Oh.
It is from the sweet, darling boy to a pile of teeth and claws when I try to cut his nails or anything.
Oh,
and he's too wise. He knows I'm going to do it. And I have no clue how to get over this.
Do you have any suggestions for how to handle that when a cat is Dr. Jekyll and Mr. Hyde?
Well, one is it'd be interesting to know. So you're getting are you getting an injection like every couple weeks, or how often is he getting an injection?
About every month. It's kind of like an athlete would get I'm not sure what it's called. I was trying to look it up here. But,
I mean, the only thing I could think of oral that would cause salivation might be what we call a rodent ulcer or a linear granuloma, which is a lesion that cats can get. And we used to do steroid injections, which is probably what you're talking about. Is that it?
That's it.
Well, you know, one problem is we used to, you know, there's different treatments for that, and it can be a difficult disease to treat. But obviously, when you're giving a steroid injection over time, and you're giving, you know, the drug that they're giving is probably Depomedrol, which is a long-acting steroid.
Yes, you got it.
Now, the good news is that's not an anabolic steroid like a weightlifter would get and you're creating a raged giant cat. It would be more of an anti-inflammatory, but still that can cause behavioral changes over time, and it would be nice to maybe try to do something different.
So
steroid.
So should she check with her vet, or might this be a good time to get a second opinion?
Well, I have a very, very capable vet up here. I mean, seriously good. Works with horses and cattle and everything around here.
Yeah, I mean, the steroid injection may be your best bet. That may be just fine. It's just you're kind of dealing with the sequela or the problems, you know, that are after that, which sounds like to me, which is what you're doing.
Right. So just going to have to kind of work with it.
Yeah.
Well, one more question. I could perhaps give him some kind of a calming medication before I'm ready to do the nail thing.
Yes, so I would talk with your veterinarian. I often use a medication called gabapentin in cats to make them happy and more tractable. We use it frequently when cats are coming into the vet. But my own cat requires a pretty significant dose when he's getting ready to get his nails trimmed. So it would be something to ask your veterinarian about because it is a prescription, but it is fairly benign and something that would not interfere with his steroid injections if your veterinarian felt like it might be helpful for you.
Okay, so some great advice. Well, we hope that helps.
I think it's very good advice.
Thank you very much for
on my
calling.
lap right now. So.
Excellent.
Excellent.
Great.
Thank you very much for calling. And I think we actually have another call already. And this one is from Jeffrey in State College. Hi, Jeffrey. Thank you for calling. And what's your question? And we have Jeffrey from State College.
Yeah, hello.
Hi, Jeffrey. What can we help you with?
Yeah, I have a 1.5-year-old Shih Tzu that I adopted from a shelter and struggling with his hair length. This is the second time now that it's happened. I let his hair grow to a certain length because obviously they look adorable with long hair, but it at around about 2 inches length, he starts turning into a Rastafarian real quickly. In a matter of like 48 hours, he's all knotted up, and as much as we want to untangle it, it's a lost case. So I was just wondering if there's an optimal, length of hair for these types of dogs. Bear in mind, he does love using sweaters, so he rocks all sorts of sweaters, and maybe that's the solution. I'm at a loss.
Yes.
Okay, so is there an optimal length of the dog hair?
So Shih Tzus are a breed that do require regular grooming, and unfortunately their hair continuously grows. So it is something that he should be groomed on a regular basis. And in the winter, when we get into this colder weather, getting him groomed, getting that hair cut shorter, and then the sweaters are a wonderful solution to that, to keeping him warm. And we'd love to see some pictures of him in a sweater, because I'm sure he's got some very handsome ones. But unfortunately, the regular grooming is going to be your answer, and keeping him clipped shorter.
Okay.
And also you can use conditioners. There's conditioners for pets to help, just like ours. I mean, I don't have that problem, but in a lot of our dog breeds, that really helps. That way you can keep brushing them out so that it gets tangled.
Okay, so a combination of little care and then maybe also a sweater depending on how the weather is. We hope that helps, Jeffrey. Good luck.
Absolutely. Thank you very much.
Thanks for calling. And we have another call, and this one is from Richard in Hollidaysburg. Hi, Richard. Thanks for calling.
Yeah, good evening.
Good evening.
We have a Shih Tzu, too.
Okay.
And what's a good thing to do for the hot spots? And sometimes his belly will get real red, the skin.
So the hot spots.
I mean, we see, so hot spots are kind of a generic term that we use, which is basically an allergy, a skin allergy. So we see skin allergies just, very commonly in veterinary medicine. In certain breeds, we see skin allergies. But one thing we're always going to want to do with a chronic allergy history is see if we can find out the cause. So sometimes there's an easy cause. Maybe you have flea bite allergy. That would be kind of an easy fix. It's never easy.
It's never easy.
Then we go into more, food allergies that I mentioned earlier on. It's very difficult to diagnose food allergies without putting them on an elimination diet for 8 weeks. Most people don't like that when you say you got to feed this bland diet for 8 weeks. So the more common allergies that we're going to see in veterinary medicine are the atopic allergies or the inhaled allergies, which are to pollens. So in the spring, it's usually the tree pollens, and in the fall, it's usually the ragweed or the weed pollens. That's very common. If it's a year-round allergy, we're going to think more about food allergies and things like that. If it's more seasonal, more of the inhaled allergens. And there's some really amazing medications that we use now. In the old days, we would use a lot of steroids. That worked great, but had a lot of side effects. So now we have a medication called Apoquel, which we use a lot of, which is a different class of drugs, and which is a pill. And then we also have a medication called Cytopoint, which I think is a miracle drug, which is an injection we use once every 4 to 8 weeks, which is actually a monoclonal antibody that blocks the allergy within the pet's own body. So you're really not even giving a drug. So my recommendation, I'm really getting to an answer, Richard, I promise you. One is, it would be always nice to know what the workup has been for the allergy. Have you done any allergy testing? What food are you on? Make sure you're on year-round flea and tick prevention, even if you don't ever see any fleas. And then the last thing I would say, once again, you have to talk to your veterinarian about perhaps one of the medications, either the Apoquel, which is the pill, or the injection called Cytopoint. If you just have a hot spot now and then, we can use some of the topical sprays. Some of the corticosteroid sprays work really nice, but it's always nice to rule out what the underlying cause of the allergy is.
Okay, great. Well, we hope that helps, Richard.
Thank you very much.
Thanks for calling.
Mm-hmm.
And if you're just joining us, I'm Ann Danahy, and this is Conversations Live, Ask a Veterinarian on WPSU TV, FM radio, and online at wpsu.org/live. Joining us tonight are Dr. Andrea Lohr and Dr. Fred Metzger. Our toll-free number is 1-800-543-8242, and they're ready to take your calls. You can also send us questions by email at connect@wpsu.org. So I think we actually already have our next question. We've got a lineup for you two tonight, and this is from Lewis in Clearfield. Hi, Lewis. Thank you for calling, and are you on the line? Hi, Lewis. Thanks for calling.
Yes.
Hi, what can we help you with?
Well, I had a dog that passed away less than a week ago.
Ugh.
Oh, I'm so
And
sorry.
I have a dog that's, I had 3 of them, and one's depressed, doesn't want to drink or eat, and just used to sleep beside the sick dog, and now she or he just lays beside the, on the spot where the one passed away. And I want to know what to do about it.
Oh, this is just a sad
That's
question.
so sad.
These dogs are attached to each other, and it's like losing a family member.
It is. So obviously, special care for your dog, lots of love and attention, and trying to do things that might help bring him out of this kind of funk. I'm sure you're grieving as well, so he may be picking up on that as well. Trying some special foods, so again, that boiled chicken, your white meat chicken, or even a little bit of canned food, something tasty that you think he might like special to tempt his appetite a little bit. And Dr. Metzger and I are probably always going to go back to that. If he's not coming out of it, then have him see your regular vet to make sure that there's not a medical issue that the stress of losing his friend has exacerbated or made more obvious.
That's really, it just breaks my heart. We have to go through this with our own dogs, and I lost a dog, a wonderful dog 2 years ago that I'm still not over, and my other dog, Sophie, it took her literally a couple weeks, and I agree with that. I think they pick up on our emotions, but frequent walks, take them to their dog buddies. Usually they're in the neighborhood, they have dog buddies. Get them out with their dog buddies. If they're not better in a couple days or week, I think it's a good idea to go see your veterinarian. And sometimes we've even used some of the things like they would do on us, like alprazolam or some of the other behavioral medications. You hate to avoid, you want to avoid that if you have to, but some dogs really take it hard, and they're picking up on multiple things. So it's like anything else, hang out with your family and your friends.
Yeah, that is
tough.
That can be very rough, because dogs and cats and other pets can make up such an important part of your family life.
Yes.
So best wishes for that.
Okay, thanks a lot.
Thanks for calling.
And dogs especially, dogs like a schedule. Dogs do not like things change. So when something changes like that, that's when it's a big problem for them. They're used to getting walked at a certain time or sleeping next to a certain dog. So that's why it's good to get a buddy and
stay
try
on
to change.
That schedule in
Absolutely.
the meantime.
Yep.
Yeah, some great advice. We have another call, and this is from Valerie in Falls Creek. Hi, Valerie. Thanks for calling, and what can we help you with?
Well, I have an 18-month-old cat, and she likes to chew on metal, wood, plastic, and I have to keep things away from her because I'm afraid she's going to get a bowel obstruction.
Yes.
But I was worried because her breath was starting to smell, so I wanted to check to make sure she still had teeth because she gnaws on everything, and her teeth looked fine, but her one gum was red. So she was just at the vet, and they said she had gingivitis. And I was wondering, can they give like an antibiotic for that? I didn't want her to lose her teeth.
Right. It sounds great that you're trying to address it early on, and we were talking a little bit earlier about teeth care. That's a tough one. Any thoughts or recommendations?
So if she's eating well, it's the inflammation probably is not affecting her to a point of severe pain, but depending on the severity of it, sometimes we will give anti-inflammatories or pain medications. Dr. Metzger might have more experience because in emergency, I don't do much with dental care. So
one thing that I would say, that's a pretty young cat, but anytime I see any red gum stuff in pets, I would like to, like in you and I, a dental x-ray is going to give you a lot more info. Now, you have a young cat, but they can get cavities like we do. It's a different type of lesion, but they can get that can cause pain. Now, usually in cats, it's going to be pretty obvious because they're not going to want to eat or sometimes salivate. Whereas in dogs, dental pain, you can have a broken tooth and a goofy lab will just keep eating, all right? So, your veterinarian already had a look and that's great. I would say if there's any more problems, maybe a dental x-ray. It sounds like you're really not having problems. And the one thing I really like is that you're worried about her chewing. There is a condition called pica. We don't see it very often, but pica is an abnormal consumption of weird things.
Oh, wow.
It was more of a disease in the older days, but it could be a behavior problem or an iron deficiency, which is pretty much unheard of in pets if they're eating a normal diet. But if you have that kind of behavior, I like what you're doing. You're already watching. I mean, you have to make sure you're keeping her away from chewing things as much as you can, because it's just the foreign bodies in cats that we see are a major problem, especially linear foreign bodies like dental floss, tinsel, shoelaces. Those are the things that cats, when they start to eat them or get them in their mouth, they can't spit them back out because they have papilla on their tongue which points backwards, so they have to swallow them. So I would just be super vigilant with the toys like you are. That would be the best advice I would give you. I applaud you for doing what you're doing so far, but keep it up.
Okay.
Because you're going to need to.
All right. Thank you.
Yeah, thanks for calling and good luck. Thank you.
Thank you. Bye-bye.
Bye. And I think we have another call, and this one is from Drew in Bradford. Hi, Drew. Thanks for calling, and what can we help you with?
Thank you very much. I have a very sweet white 1-year-old female cat, and I suspect she's got eye infection. Her eyes, of course, are on white fur, and there's a black stuff that comes out of the eyes, and then it goes away, and the eyes look fine, and then the one eye looks a little smaller than the other, and I'm just not sure what to do.
Okay, so it says pretty common eye infections in cats and kittens, young cats.
It can be. So one of the great things that you can do, Drew, when she has this problem is try to take some pictures, because that can help your veterinarian, because of course then it's a couple days later when you can actually get an appointment to see them, and things might have changed since then. If she doesn't seem to be squinting or painful in her eyes when this happens, it may be just normal discharge from the eyes. But if they're red or she seems uncomfortable, then it could indicate that she does have an infection. A lot of cats have a herpes virus infection, kind of like people get cold sores. Cats, it manifests in their eye, so it lives in the nerve in the eye, and when they get a little bit of stress, it can show up. So if that's what it is, your veterinarian can actually help you with treating her with a supplement called lysine, which has been shown to decrease the severity and duration of those flare-ups. But I think taking some pictures and taking them to your veterinarian and her as well might give you an idea of whether this is a problem to be terribly concerned about or something that they think is probably going to end up being normal for her.
I hope that helps, Drew. Is that something that you oftentimes tell people with certain types of conditions to get pictures of it?
Absolutely. By the time you get to your veterinarian, things will have changed. So pictures, or if your pet does something weird at home, grab your phone and take a video. I can't tell you how many times on ER I'm able to make a diagnosis based on a video that the owner shows me because the pet gets to the ER and is acting perfectly normal.
Right.
Especially seizures. I mean, that's the biggest thing that we're going to see. Videos are really helpful. And the only other thing I was going to say on eye discharge, it can be from like nothing, who cares, to a serious problem. So this doesn't sound horribly serious, but I always want to know, are there any other signs? Is there sneezing, coughing, rubbing of the eyes? Drew, it sounds like you're not really seeing any of that, right?
No, I'm not seeing any of that.
Okay, good.
It just seems like, there's this black stuff that comes out of the eyes, and then, as I said, the one eye seems to be just a smidget bigger than the other occasionally, not all the time.
Yeah, I mean, the other thing that we can do, that your veterinarian can do fairly easily, that we do frequently when we're dealing with eye problems, is do a few things. Do a tear test to make sure we have enough tears. And the other is to use a fluorescein dye, which if you've been to your eye doctor, they put that little yellow drop in your eye. We do the same thing, and we can look for drainage of the tears. In dogs and cats, we have 2 tear ducts in each eye, and we look for those tears to drain. And that dye, we can follow that dye with ultraviolet light, back to our 7 days of 70s who was around, the black light, and it works really well, and we can see whether the tears are flowing normally or if we have an obstruction in the tear duct.
Okay, so some different possibilities you might want to talk with the vet about.
Yep.
All right.
I understand.
Hope that helps, Drew.
Thanks very much. I really appreciate your concern.
You betcha.
Thanks for calling. And we have another call, and this one is from Susan in Bollesburg. Hi, Susan. Thanks for calling, and what can we help you with?
Yes, thank you. Can you hear me okay?
Yeah.
Yes.
Wonderful. Thank you. Thank you for your program. It's so wonderful. Thank you. Thank you to the vets for being here.
Sure.
Yes, our expert guests.
Yes, my question is with regard to allergies that pets have. I've been watching the program, and Dr. Metzger had mentioned about 2 different medications for possible allergies. Now, my cat appears to have skin allergies, so the question is, can they have allergies to kitty litter? And also, can the medications that Dr. Metzger mentioned earlier for the dog, can they also be used for cats?
Great question. So one, definitely cats can be allergic to certain litters. Normally it's more of a respiratory problem though, like asthma. Not as much skin, although it's still possible. Cats are really susceptible. When I hear, especially if it's a chronic allergy, I'm gonna really look for food allergy in the cat. It's pretty common. It can be difficult to diagnose. But if it's more of an itchy problem, I'm going to go back to what I said before. One is you have to have stringent flea and tick control, even if it's an indoor animal. You can do allergy testing. There are some tests for the atopic dermatitis, which are the inhaled allergens I mentioned. That's a blood test. They're about 70% effective. The food allergy tests are just not good. You can have them run. I find them to be a complete waste of time, and the dermatologist will tell you the same thing. So on the medication, on the Apoquel, a lot of them are labeled only for dogs. The truth of the matter is we are using some of them in cats now, and we can use other medications in the cat as well. So the Cytopoint, which is the monoclonal antibody for dogs, we can't use because it's a specific antibody for the dog. But some of the other medications that we can use work very nicely, and there's other ones too that we can use, some of the newer ones. The steroids we used to use all the time, we really are trying to avoid those because they have side effects, diabetes, cardiac disease, and especially in the cat. So we try to avoid the steroids if we can. Sometimes we still use them, but there's better meds now.
Okay. All right. Well, I hope that helps, Susan.
It helps tremendously. Thank you so much.
Well, thank you very much for calling. And if you're just joining us, I'm Ann Danahy, and this is Conversations Live, Ask a Veterinarian on WPSU TV, FM, radio, and online at wpsu.org/live. Joining us tonight are Dr. Andrea Lohr and Dr. Fred Metzger. Our toll-free number is 1-800-543-8242, and they're ready to take your calls. You can also send us questions at email at connect@wpsu.org. So we've been getting a lot of great questions, and it looks like we have another question already, and it's Alexander from Penn State. And Alexander, thanks for calling, and what can we help you with?
I just want to let you guys know that Ted Gunderson was right. He did discover a tunnels under the...
Oh, you're falling out.
I think Alexander went to the Shandy Gaff first before he called. That's what I think. He's from Penn State. Having a good night, Alexander. Knock yourself out.
Well, while we're waiting to see if Alexander calls back, I have a question. So fleas and ticks, that's a big problem, obviously, especially dogs. You're walking them outside, or if you have a cat that's indoor, outdoor. Is that something you need to worry about over the winter? I mean, the temperatures now, they're in the 40s, but even when it gets cold again, do you still need to worry about fleas and ticks, Dr. Lohr?
Yes. So most of our prevention products now are monthly. And within a month, we can, even in the middle of February, we can have 1 or 2 warm days that are warm enough for ticks to be out or fleas to be active. Also, fleas can be in the house. So keeping your pets on flea and tick prevention year-round is extremely important.
It's your #1 problem in central Pennsylvania, and not just Lyme disease. We're seeing an epidemic of a disease called anaplasmosis, tick-borne, transmitted by the same tick, which is the tick on there. It's just, I beg of you, flea and tick control year-round. Definitely in the dog, and you really need it in the cat. We've got great products now. There's Bravecto, which is a chewable pill in the dog, 3 months, flea and tick. In the cat, there's a topical Bravecto, 3 months. So it's just a must. The ticks are a major problem. I go in the woods with my dogs. I pulled a tick off my inside of my knee last week. I mean, it's cold already. It's year-round. These are huge diseases in our patients. We're seeing them all the time, and they're totally preventable. So you got to use flea and tick prevention.
What about for indoor cats? If you're keeping your pets indoors all the time, do you still recommend it?
We do, yes.
do, okay.
Because we can even bring flea eggs or ticks in on our shoes or our clothes, and so trying to ensure that your pets are protected, even if they never go outside, is very important and well worth the.
We're laughing at the never goes outside because
Yes.
everybody says that.
Right, and you suppose you never know too.
And I mean, clearly, if it's always an indoor cat, I understand, okay? But if your cat's going out at all, or if you have a dog, you have to, and you live in this area, or Pennsylvania, a lot of the callers, Bradford County, I mean, these are big areas for fleas and ticks, the whole state of Pennsylvania. Very big problem. So we can prevent them with good flea and tick problems. And in dogs, make sure you're doing the Lyme vaccine. We don't have one for cats. There's a really good one for dogs. You have to get your dogs vaccinated for Lyme.
Okay, that's great to know. And we do have another call, and this is from Jeff in Jacksonville, Florida. And I think Jeff is a Penn State grad. Is that right, Jeff?
No, my daughter and son-in-law are Penn State grads.
Okay, all right.
Wonderful.
Thanks for calling.
Well, we got that right at least, Jeff.
Yeah.
That's good.
What can we help you with?
I'd like to know if there's any correlation between the flea and tick treatments that pets have been receiving over, I guess, years or decades or whatever, and the kind of increased recurrence of cancers in pets. Has any of that been looked into, or is there any truth to that? We lost a beloved pet a few years ago and out of cancer for years, and he had been on, flea and tick and heartworm treatment and stuff like that, and I just kind of wonder if that's been looked into.
Yeah, it's a lot of research. Because on the medications that we're talking about now, these are, most of them, it depends on what product you're on, are FDA approved medications. So, I mean, these are FDA cleared medications and have had a lot of study, and that's been looked at pretty convincingly. And I'm never going to say never, because, I mean, there's a lot of different flea and tick products out there, and there's several different heartworm preventatives, but you always have to look at the risk benefit. Like, Jeff, you're in Jacksonville, Florida. I mean, that's a huge area, as you know, for heartworm disease, and which is a mosquito-transmitted disease. So you're much more likely to have heartworm disease than a side effect. You can have a side effect to any medications, but the short answer is highly, highly, highly unlikely. And the bigger problem is the flea and tick transmitted diseases and heartworm disease transmitted by mosquitoes are a far bigger risk for the commonly used flea and tick treatments.
Well, I get this question a lot about many things, about flea and tick, about the diets that we're currently using, things like that. So I think one of the things that we need to remember is that our pets are being better taken care of nowadays, and so they're living longer. And whereas, 30 years ago, trauma was a more likely cause of death for our household pets. Now we're taking wonderful care of them, and they get to an age where cancer becomes a more common possibility.
Well, and our diagnostics are so much better now. We're picking up things just like in human medicine. I mean, we're doing CTs on pets now pretty routinely, so we can find things a lot earlier. So I'm not going to say never, but there have been a lot of studies done, and you want to prevent especially heartworm and flea and tick diseases. Your pets are going to live a lot longer.
We hope that answers your question, Jeff, and thank you for calling us from Florida.
It did, and thank you so much for the vets. I appreciate what you're doing for our animals.
Oh, thanks, Jeff.
Absolutely, thank you.
And we have another call, and this one is from Ann in State College. Hi, Ann. Thank you for calling, and what can we help you with?
Well, I have heard you referring to the feeding the animals white meat. I'm just quite curious, what is the difference? White meat, dark meat, like meat's meat. How do you explain white meat?
Sure, there's a big difference. White meat is the lowest fat part of a chicken or turkey, so it is least likely to cause intestinal upset. When we, as Dr. Metzger mentioned earlier, when we're looking at foods that are easy on a pet's stomach, the lower the fat content, the better off we are. So that's why we are specifying white meat versus dark meat. The reason most people love that turkey leg so much is that it does have more fat in it.
Okay, thank you.
Hope that clears things up for you, Ann. Thanks for calling.
All right, goodbye.
Bye-bye. So if people are concerned about their pet and they think the pet might be getting ill, as a cat or a dog or a pet rabbit, whatever it is, how do you know when this is something that needs emergency care and I need to get treatment right away, or this is something that maybe I can kind of wait it out? Are there any tips that you give to people to try to figure out when is time to get emergency care?
So I'll let you start.
So I've been a vet 33 years. I think everything's an emergency, to be honest with you. And the reason I'm saying that, we can talk about coughing is an emergency, an animal trying to give birth, those are common, all right? Vomiting is an emergency. But diarrhea, we wouldn't normally consider to be an emergency, unless it's our own pet. Like if my dog has diarrhea, it's a big deal. So what I'm saying is the more traditional emergencies would be trauma, vomiting, coughing, any eye problem. But I think if someone's sitting there and they're concerned, that's why you got 24-hour, I got 24-hour. Hopefully you have 24-hour in your town. I mean, that's why we have 24-hour. That's why you call, because I don't like it when people wait and it becomes a bigger problem. That's not good for anyone.
So erring on the side of caution.
In this area, there's no reason to sit at home and worry. Because we do have 2 great hospitals that are open overnight, and when your regular veterinarian's closed. And you can always call and talk with the front desk staff. Both of our hospitals, our receptionists are well versed in how to help you triage over the phone what might be an important emergency.
Now, if let's say you're somewhere and there isn't an emergency hospital, we're lucky. There's 2 of us because most towns don't have an ER, so that's scary. But the clear emergencies are going to be an animal that's vomiting. If you have a large breed dog, we see bloat in large breed dogs where they have a twisted stomach. That's an emergency. If that doesn't have surgery immediately, and sometimes even if they do have surgery immediately, they'll die. I mean, that's a true emergency. So vomiting in a large breed dog, coughing, seizures. The truth is, by the time someone comes into us, your dog's done seizuring.
Most
but
likely.
you know that's typical.
If we're lucky.
But that's why I'm saying eye problems. I don't like that. Anything's an emergency. If you need someone, you got to call.
Err on the side of caution. Okay,
Yeah.
That's great advice. And we do have another question, and this is an email we got. And this is a question from Ray. And Ray writes, my 2 dogs, sisters, they're 3 years old. They eat a lot of grass, roots and all. We've tried different foods with no results. Any suggestions? They're eating the grass.
Try not to let them do it. Even to the point of if they're really going after it, basket muzzles to try to prevent them from actually ingesting it. We actually can see grass impactions. I took about 3 pounds of grass out of a dog's stomach one time because it couldn't pass through. So anything you can do to deter them is really encouraged, and keep them moving.
Well, I'm surprised because I would have thought it would be okay to eat for a cat or a dog to eat some grass, but no.
I'm going to disagree a little bit.
Okay.
Like, just because I had a lab that ate grass every day. She grazed, not huge quantities of grass, but I saw this dog for 12 years. She had long blades of grass, and she would eat a few of them. It made her very happy. So generally, I wouldn't want them eating grass. But like, if it's a little bit of grass, I'm not going to freak out about that as long as it doesn't have a chemical spray on it or it's a small amount. I'm going to go back to my chocolate comment in dogs. Some of them can eat chocolate depending on the type and the dog, and they don't have a problem. Some eat it, and they can have a huge problem and die from it. So there are some individual variations. I'd say the longer the grass, the worse, because you don't want to get a foreign body.
Even mowed grass, though, can be a problem. So,
yeah, it depends on how much they're eating. It's like anything else.
But in any case, keep an eye on your dog. So we are almost out of time here, and we're just going to have a quick wrap-up round and some do's and don'ts for people over the holiday season. Dr. Lord, what would you recommend some good advice for people to keep in mind for their pets over the holidays?
So keep in mind, when you have friends over and they're bringing their pets, not all pets get along. So careful introductions, and even once they're introduced and they know each other, being just very cautious. One of the biggest emergencies that we see over the holidays is dogs getting into fights with each other. So be careful.
Great advice. And how about you, Dr. Metzger? Any do's or don'ts?
I think the big thing, that's a great suggestion, because we do see that. People think their dogs want to get together. Some dogs just like to be alone, all right? Moderation is what I'm going to say. A little bit of food is fine, depending on the food. But the other thing, if you're traveling, please make sure your dogs have identification or they're microchipped. We see dogs that will get loose. they're in a strange environment. It's really hard to get those dogs back. So if you're traveling, make sure your dogs have ID. Make sure the people that you're visiting want you and your dog there. You know, that's a big deal. It's like bringing someone else to dinner that has poor table manners. You know, it's like, and keep it in moderation. Of course, most people know no chocolate, but you know, no onions, no macadamia nuts, no raisins.
Okay,
And
so
just bring their dog food. Try to keep them on their normal diet. Dogs like a normal routine. They do not like straying from their normal routine.
So again, going back to that original advice, if you want to give them a treat, just make sure it's something plain and simple, a little chicken, but not lots of funny food and not lots of funny toys too. Toys can be their own problem, is that right?
Yes, they can be.
Because I imagine at the holidays you'd want to give your cat or your dog a toy.
Yes.
But
So find those things that they like to play with and utilize those. You know, buy more of the toys that they already have that they like. And just be monitoring to be sure that they're not ingesting them or tearing them apart.
Well, thank you both so much for coming in and answering all these questions. It's been great.
It's a lot of fun. The callers make the show. I mean, we're just sitting here having a discussion. So
this
thank
has been
you to the
wonderful.
callers. Thank you for your great questions.
And thanks for your answers. We've been talking with Dr. Fred Metzger, Medical Director of Metzger Animal Hospital, and Dr. Andrea Lohr, Medical Director at CP Vets. I'm Ann Danahy. From all of us at WPSU, thank you for joining us and best wishes for a happy, healthy holiday season with your pets. All right, we didn't even get time to get to the picture.